Bring somebody in who is on the front lines at a hospital in Tennessee. This is Dr. Daria Long. She's an emergency room physician. She's been treating coronavirus patients. Dr. Long, so let's just go with the breaking news. You've been treating coronavirus patients. Are you in self-quarantine right now?
So, Allison, thank you for having me. This is a tough call. I did 4 shifts just in the last week alone, extra shifts because we had some physicians call out. So I'm trying to isolate as much as possible. I have a young family, and then I have to go back to the hospital. And I think we can't forget, if I have been exposed to coronavirus, I still have other patients who don't have coronavirus. Patients are still coming in with strokes and cancer and heart attack. I can't be passing along coronavirus to them.
You also say you have already been told that you need to take care of your own protective gear, in some cases buy your own protective gear. Is that right?
Several of my colleagues nationwide have been told they should buy their own protective gear. We've gotten emails, some of us have gotten emails that you should put your masks in a paper bag in between patients. Somebody else said maybe put your mask in a Ziploc bag after a shift. Sanjay, I don't know about you. What am I supposed to do with these Ziploc bags of masks when I get home? Am I supposed to put it in my trunk? It's not a good way to keep our physicians safe, and most importantly, then our patients.
I mean, look, it's really frightening, Daria, and I know that you have to consider your own family as well. I'm hearing about doctors who essentially have one of these N95 masks. They're treating it like it's gold. They're told oftentimes for a couple of weeks that's the only mask they may have. Typically maybe we overused a lot of this personal protective equipment in the past. I mean, there was always masks and gloves and everything sitting outside, the various patient areas whenever I needed them in the past. That's not the case anymore. They're under lock and key. And look, as we're hearing, the people who are taking care of these patients can't necessarily count on being able to have that equipment right now. I think we have a graphic. Let me just show you quickly, just the masks. We've talked so much about ventilators, but how many masks are projected to be necessary is around 3.5 billion of these face masks, and the country generally makes about 1.5 billion a year. So significant shortfall. They're trying to up the production of these masks, but there it is. But we're not there. And look, I just want to modulate myself a little bit here as we talk about this. But I think part of the reason people are really frustrated is A, they don't have the masks. B, we knew this was coming. We've known this was coming for 2.5 months at least. I mean, there were certain things that could have been done. You take out healthcare workers, and the system's going to have a very hard time continuing to run. And the idea that healthcare workers, even after they've been exposed, should continue to work, possibly becoming sick themselves and infecting others. That can't be a long-term strategy. That just can't work.
But Sanjay, isn't Dr. Long in that category? There are coronavirus patients that you, Dr. Long, correct me if I'm wrong, you've come in contact with that are being treated at her hospital, and she's going to work every day. Isn't she already in that category?
Yeah, yes, you are. And the problem is all the testing also takes 3 to 5 or more days. So there's really no way if I was exposed Monday or Tuesday during a shift to know actually if I really truly was exposed and infected by it. And I have other colleagues across the country who are emergency room physicians who have symptoms of coronavirus. They're not sick enough to be admitted, so their hospitals are telling them, since we don't have enough tests, just go home until you're asymptomatic for 72 hours.
And Dr. Long and Sanjay, as we digest this news, and I think we're all trying to figure out exactly what this means, because this seems like a big change, and I'm not trying to make it sound scarier than it is, but it does raise your eyebrows. But Dr. Long, while we have you here, just tell us what it has been like for you the last few days. What have you seen in terms of the number of patients and the age range of the patients you're treating?
John, I'm glad you're asking this because we are seeing, yes, of course, we're seeing people who are older having respiratory problems, but we're seeing a lot of people in their 30s and 40s and younger who are coming in. Their oxygen levels are a little bit low. Their heart rates are up. They're sick, and some of them are being admitted, and across the country, seeing people in their 40s on ventilators for prolonged periods of time. That's unheard of. We don't normally see that.
There's just no way that that's not scary, Sanjay. I mean, you're trying to modulate, so are we, so is everyone, but there's just no way that what emergency room doctors are seeing across the country is alarming.
Yeah, and let me just be clear, Allison, to your last point, because I think it's an important one. Here's the scenario: patient comes in, you don't know that they have coronavirus. They come in for something, maybe they're just some basic symptoms. What would be ideal? In an ideal scenario is that any physician, any healthcare provider who's going to examine this patient has personal protective equipment, right? Right away, they can put that on and go see the patient because the patient is basically an unknown at this point. But given how much coronavirus is circulating, you have to assume that maybe they could have coronavirus. Because there's not enough personal protective equipment, doctors, residents, nurses, whoever may examine this patient, then subsequently find out the patient has coronavirus. That's what happened at the hospital. 7 physicians, that happened to them. Now the question at that point is, what should happen to those physicians, nurses, whoever? What should happen, as Dr. Long was talking about, they should be able to quarantine for 72 hours. Instead, now what they're being told is, you've had an exposure. You didn't have personal protective equipment on at the time. You've had an exposure. If you're not symptomatic, go ahead and continue to work, but you have to wear a face mask. Problem is, for the same problem in the first place, they didn't have a face mask. So they can't wear a face mask, so you know what? Maybe you could wear a bandana or scarf. I've just laid out a scenario of events that is happening in hospitals all over the country.
Dr. Long, Dr. Sanjay Gupta, we really appreciate you helping us understand this breaking news. Obviously, we're getting developments throughout the program. The CDC has just updated their website, Sanjay, as you told us. Thank you both. And Dr. Long, thank you very much for what you're doing.